Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh dan salam sejahtera. Salam Malaysia Madani. A very good morning to all. A very good morning especially to our speaker, Mister Bandu Soma from Sri Lanka, but he's working in IES or US. Yeah? So Bandu, can you on your mic and video now?
Good morning, Farisa. Now I am audible. Am I audible?
All right, now we can see you. All right, thank you. So allow me to all participants, we have 102 participants now. Dear participants, so allow me to coordinate this session in English. Yeah? All right. Alhamdulillah, syukur kita. So we have Mr. Bandu with us. So for your information, Mr. Bandu, this is the 12th ISW, the International Scientific Webinar of 2025 that is organized by PPSM, which is stand for the Persatuan Pegawai Sains Malaysia, the Association for Science Officer in Malaysia. So thank you once again to Mr. Bandu for your busy time to be with us and to share with us your vast experience when you since you involved with 15189 and also the assessment, evaluation and accreditation per se. So allow me to just read a bit of the background of our speaker today. Mr. LHD Bandu Soma is a program manager in International Accreditation Services, IAS, overseeing accreditation program for medical laboratories, proficiency testing providers, and reference material producer. He holds a multidisciplinary qualification, including degree in forestry and environmental science, food science and technology, and public administration in e-government. Wow, so that's why he can handle many scheme in accreditation. A qualified APAC lead evaluator since 2015. So that's also another point with his vast experience. So Mr. Bandu has conducted extensive peer evaluation of accreditation bodies across Asia Pacific region and also serve as APAC trainer, delivering national and international training on accreditation and conformity assessment standards. He is also a team leader across all accreditation schemes, such as laboratories, inspections, validation and verification, and certification body. Okay, with over 2 decades of his experience, he previously served as a Sri Lanka Accreditation Board SLAB, advancing to the Deputy Director in accreditation and playing a key role in developing accreditation schemes under APAC MRA. He is currently also contributes as a visiting lecturer at the University of Sri Jayawandapura, teaching laboratory accreditation, quality assurance, medical laboratory accreditation, auditing, and also environmental management. So with that intro, we would now hand over to Mr. Bandu. We have approximately 45 minutes or 50 minutes for your presentation. And for participants, the Q&A will only allow after the presentation, and feedback form, e-cert and also attendance will be posted in the chat of 30 minutes after presentation starts. Okay, so let us give a big clap to our presenter, Mr. Bandu. The floor is yours. Thank you.
Good morning, everyone. So I think I am audible
Yes.
and see my presentation slides. So first of all, I am very much pleasure to be online and participate in this international scientific webinar organized by Malaysia Association of Science Officers. And thank you very much for inviting me to deliver this small presentation about my sharing my experience in the ISO 15189 accreditation activities and also APAC and ILAC evaluations. Thank you very much, Farisha, for coordinating and giving me an introduction about myself and also inviting me for this webinar. So first of all, I will start the presentation. Before that, before starting the presentation, I will have to inform you. So as we are delivering this one in a common language, English, sometimes there may be some misunderstanding, any unclear area. So because we are not the native English speakers, so then I apologize any misunderstanding or any clarity. But if you have any questions or anything, so then at the end, as Ms. Parvisa inform you, so we can discuss. And I think I gave a permission to this association to share this presentation, whatever the video, then you can later also you can go through. So with that, I will start my presentation. So my today's discussion or topic is ISO 15189 excellence practical perspective from a medical laboratory assessor, APAC, ILAC evaluator. So this is myself. So already Parisa gave me about my long introduction. So you can call me as Bandu. So then very easily we can communicate. So content under this title, I will try to discuss about what does it mean by the excellence in 15189 and to understand the medical laboratory activity, we should know what are the factors affecting the accuracy of the medical test result. And I will give you some overview about ISO 15189 2022 version, that is the current and latest version. And also sometime we can discuss about the sometimes the people will think whether we need to, as a medical laboratory, whether we need to go for 9001 certification or which one is the better one, ISO 15189 accreditation or 9001 certification. So then I will show some information. And also all nowadays all these standards are very much talking about the process approach as well as risk-based approach, risk-based thinking. So then I will give brief overview about the process approach as well as the risk-based approach related to medical laboratories. And so then I will go to LQMS, Laboratory Quality Management Systems, and accreditation assessment, some points, and also APAC ILAC evaluation. During my discussion, I will give some example scenarios only for the sharing experiences, and also as I'm talking to the scientific community, I will give some already published papers, publications. I I downloaded something, some important publication. So that will give some information for you to start your scientific research. And when you do the research, then you can focus on this medical laboratory area also. So then there will be at the end discussion. So, what does mean truly mean in ISO 15189 excellence? If we talk about excellence, so is it beyond compliance? Because all the ISO standard, so you know that there are ISO standard guidance documents. So that will give some guidance and also interpretation for the users uh, about particular subject area. And also there are some standard requirement standard. So sometimes there are some standard, it gives guidance as well as requirements together. Sometimes there are some requirement standard, it gives only the requirement, right? So there are different type of standard. So if we take ISO 15189, so it's like a requirement standard for medical laboratories. So mainly if we get the 15199 standard, so we can think about how we can comply with this standard. And so to become an excellent, to show our excellence in implementing ISO 15189, then we have to think about beyond compliance. And also when we comply with the standard, when we are going for the beyond compliance, then we have to think about how we can create confidence about our services among our medical laboratory users. It may be a patient, and also sometimes some maybe physicians or doctors or some insurance companies, some regulators. So all these people we can consider the medical laboratory users. So then how we can create a confidence about our services. So what do we think about it? Excellence means we do whether we have a proper documentation or zero non-conformities, somebody can say. We are running our medical laboratory with zero non-conformities. We didn't identify any non-conformities during the past 2 years, 3 years. We are excellent laboratories, or zero complaints. So we are satisfying our customers. We properly identify the customer needs, customer requirements, and we, as a laboratory, we provide the services. And also when we satisfy the customers, so we have met the turnaround times. So that means the customers are very satisfied. We have not received any negative feedback. Our customers mainly, we can use the customer, we can replace the medical laboratory users. It includes patients, all the other parties. And also when we, as a medical laboratory or our associated, we have associated POCT, point of care testing services. So right, so then results of EQA, IQC. So we participate external quality assessment, and also we have internal quality control activities. So in the laboratory, we will day to day we will do before issuing that patient results, we will check whether today my laboratory, my environment, my equipment are ready to deliver the correct results. So for that, we will use internal quality control activities. And also, when you do the test, sometimes there may be some systematic issues with your system, and you have to want to check whether I am performing correctly. So then for that, we have to go for the external quality assessment. That means we compare our total laboratory system with external values or external systems to check if there are any systematic errors with our system. So like that, we can think about in a different way. What is the main objective? So we should be able to consistently deliver in the reliable, clinically valid results that protect the patient safety, because patient safety is very important point in the 15189 standard. As a medical laboratories, we have to give more attention about the patient safety. So many laboratories achieve accreditation to ISO 15189, but excellence means sustaining reliable performance sustaining while giving reliable services and also performance every day, and continue to improve the laboratory activities. So then Now, when we go to the excellence, so then we can think about in a different perspectives. So if we consider the patient-centered outcomes, right? So what is the main objective of our laboratory? To deliver accurate, reliable results. So then to become as excellent, so then we can have some other objectives, some quality indicators. So then we will go through, we will take some actions, we will have some policies and processes to satisfy the customer requirement, our patient requirement. Then also in a laboratory, so competent people. So training plus demonstrated competence will give more value additions for our laboratory activities. Then effective and control processes across all testing phases. So now you know in the medical laboratory area. So when we talk about according to the previous ISO 15189 standard, ISO 15189 2012 standard, we consider pre-analytical, analytical, and post-analytical phases, right? So now in the new standard, new terminology, new ISO 15189 standard, they have removed the testing part and also analytical part. Now they have introduced examination. So now we can call it as not the, earlier we call medical testing laboratory. Now we can call medical examination laboratory because they have commonly used word is examination. So according to that, according to new standard, so now the medical laboratories has have three phases, that is pre-examination, examination, and post-examination processes phases. So then when we when you carry out our different activities related to different processes, so we have to have a well-defined processes. So normally when we take the process mean is a interrelated different activities, set of activities that will transform inputs into outputs, right? So then when we define our processes for all three phases, so we have to consider about process approach. That's why I will later I will talk about little about the process approach that should be followed by a medical laboratory. Then risk-based thinking embedded in daily laboratory work. So every day, sometimes we know this is a risk-based activity, or sometimes without knowing, as a laboratory staff, we will carry out our laboratory activities uh, on a risk-based thinking. So we consider the risks, what are the risks associated with my activities, and then we will take some precautions, some actions to prevent any harmful situation from this our activity. Then the data-driven decisions, right? So now when we carry out day-to-day activities, so we will use as example QC, EQA, turnaround time, and complaints. So sometimes as a medical laboratory, so you may set some targets or some requirement for acceptance and rejection of primary sample as example, right? So then day to day, you have to think about what is the risk of sample receiving, or what is the risk associated with the primary sample, right? So if the what is my objective is my primary sample must be suitable for further testing, right? So if the sample is not suitable, right, if something happens, that sample cannot be further processed through our testing process. So that is one of the risks, right? So for to avoid those type of risks, then sometimes you will give some instruction, you will train the people, sample people, phlebotomists, and every people, and you will make sure that they follow the correct procedures, they follow the correct instruction, and they will bring the sample to your laboratory without any deviations, right? So even though with that steps you have taken, then you will introduce another step in the receiving. You will check the suitability of sample before accepting sample. So therefore that you will have some acceptance and rejection criteria, right? So there you will record sometimes how many samples we rejected today, and what is the reason, right? So if you record that one only in a book and you will not take in that information for any other work, so that is not good, right? So if you have recorded, if you have observed, these are the situation, these are the samples rejected every day, and this month how many samples rejected, what are the reasons. So if you analyze the data information, then you can think about some trends. Same thing for the QC, EQA, right? So then that means as a medical laboratory, if we use our available data, information, and if you manage them correctly, then we can do a lot of things to become as excellent medical laboratory, right? So strong leadership and positive quality culture. So that is also we need because this is not a one man activity, so this is a teamwork, right? So then we have to create a team culture, teamwork culture in our laboratory. So every person, even the cleaning person to the up to the laboratory director head, is very important role, because we can't uh, exclude any activity, any position from this activity. This is a teamwork. So then to get the teamwork correctly towards a good direction, so then we need the leadership and also positive thinking uh, staff, quality culture, right? So then the continual improvement with verified corrective action. So and also some data analysis. So we have to day, initially we in that if you go for the accreditation, first year you will get the accreditation. So that is the you are meeting the minimum requirement. But so day to day after getting the accreditation, if you think about now we have got the accreditation, now we are okay. So then you will at the next surveillance, next reassessment, you will face so many difficulties, because with the experience of getting the accreditation, implementing the procedures new as a new laboratory, so then you have to think about how we can, because initially you will think about some this is the way we are going to do, this is the way we are going to do. But when you practice your policies, your procedures, sometimes you also feel, why we have defined like this, why we cannot do like this, right? So then you will, by experience, you will think about now you will do some changes, you will introduce some changes, some improvement, new activities. So like that, then you can day to by day, you can improve yourself. And also, when you implement the procedures, so easily you can detect any deviation from your defined requirement. So any deviation from the defined requirement is an unconformity. So if you identify the nonconformity, so then there's another process for handling of non-conforming activities. So under that, then you will identify what is the root cause, and also what is the actions we have to take, immediate action, correction, and what are the action we should take to prevent the recurrence of this issue not to happen again and again. That is the corrective action. And after implementing corrective actions, then you have to verify whether it is effective or not. So likewise, then you will follow the corrective action process. Through that, then continually you can improve your quality management system to become as the excellent medical laboratory. Then once we get the accreditation, so if you go through with the standard Malaysia, so if you go through with the ILAC MRA partner, right, or APAC MRA partner accreditation body, so then you can get the international recognition. That is also that will give the your recognition for your activity. So then the culture, I already touched some of the things, so that is very important, team culture. And also we have to keep in mind, so this, if something happened, if there's some deviation in the laboratory, if so we should avoid blaming culture, right? So we should not blame to the people, because if we do the, if sometimes because people we are working in the laboratory, people are working in different area, but there may be some situations. So we sometimes today I have accepted sample that is not suitable for testing. So then if I blame as a manager, if I blame to the staff, sometimes they will not contribute to other days, because this can be only one situation. So if we go back and analyze the root cause, then sometimes that is not the issue with that particular person, right? Sometimes at the point of the receiving the sample that day, the thermometer is not working, because they have to check the what is the receiving temperature, right? But that person accepted, maybe sometime issue with the thermometer, right? But if you blame the person, then that is not good, right? So this, because of that, so when we go for excellence, so then we have to consider these points and follow the required steps. Okay, we have to introduce the policies, procedures, like that. So then, as you know, I will not take more time. So what are the factors? Because if we are going for the excellence medical laboratory, so then we have to think about what are the factors affecting the laboratory results. So then if we more focus on those factors, so then day by day you can avoid any mistake, any errors, and also you can improve. You can achieve more improved targets. So like equipment, consumables, the purchasing materials, and understanding test requirements, examination method, sample collection, recording, right? So EQA, IQC, right? So like that. So you can see if you go to the ISO 15189 standard, so for all this, there's a requirement. So why that committee, technical committee, they understood. So these are the main points that will affect the accuracy, reliability of the medical laboratory test results. So then we have to introduce some requirement on that. Then if the laboratory follows those requirements, so they can make sure their results are accurate. So then you can see that this is the standard. I think many of you have seen this standard. ISO 15189 is 2022 version, is the current version. And also, if you remember, so if you work in a medical laboratory from this January, next January, this is the previous version is not valid. So now I think you all have transferred earlier laboratories, those who have accredited for the ISO 15189 2012. Now you have transferred to 2022. So this standard is aligned with the common requirement of CASCO and ISO 17025. So normally CASCO mean there is the ISO Committee for Conformity Assessment Standard. So they are the responsible committee for the developing the conformity assessment standard, mainly 17,000 series standard. But in the medical area, so the medical lab, what are the series, standard series related to the medical laboratories, it is coming under ISO 15,000. So because of that, this standard also coming under ISO 15,000 series as 15189. But this is also we consider as the conformity assessment standard. So and also then there are some other ISO standard related to the 15 medical laboratory, but here this is the requirement standard. So you can see medical laboratories requirements for quality and competence, right? So it covers both quality and competence. So it aligns with the 15189 standard. So this replaces 2012 version, and also it incorporates the requirement of POCT. If you remember ISO 22870 2016, that covers the requirement for point of care testing. So now they have incorporated the requirement for the POCT into the new standard. So from 2026, so ISO 15189 2012 and also ISO 22870 will be over, because now the new standard covers both. Then increase the emphasis on risk and management and the risk-based approach in the new standard. So there are many places we can see they are talking about the risk and moving from analytical phases to the examination processes. Then address new technologies and emphasis on the patient safety and satisfaction by users, medical laboratory users. Then the give flexibility in the laboratory structure. So then the less perspective requirement and allows lab to implement practices that work for their unique situation. So then the standard, this is like a almost general standard, generic standard. The 15189 2022 does not explain So this is the requirement for medical microbiology. These are the requirement for histopathology. This gives a general requirement. So then we can interpret as a laboratory users, we can interpret the standard relevant to our field and develop our laboratory quality management system. So these are the content of the standard. So this also the structure same as the ISO 17025 standard. So it covers scope, normative references, terms and definition, general, structural, resources, process requirement, management system requirement, like that. So there are some annexure, Annex A. So they have given additional requirement for point of care testing. So this is the something now. Sometimes you can think about as a medical laboratories. If you are working in the medical laboratory, you can see can we take ISO 9000 for our laboratory? So do we need to go for the accreditation ISO 15189? So you can see that there's in the ISO and the ILAC website. This is there. So joint IF, ILAC, ISO communique on the management system requirement of ISO 15189 medical laboratories, and they have informed that all the community. So their joint communique is they have given a medical laboratory's fulfillment of the requirement of ISO 15189 means the laboratory meets the both technical competence requirement and management system requirement necessary for it to consistently deliver technically valid results. The management system requirements in ISO 15189 are written in a language relevant to the medical laboratory's operation. Medical laboratories that implement ISO 15189 operate generally in accordance with principles of ISO 9001, right? So normally ISO 9001 is a management system standard. It's a requirement standard for the quality management system. That standard does not cover the competence requirement. So that is the main thing. So if as a medical laboratory, if you get the 9001, then that will give that your compliance to the quality management system. But it doesn't show your compliance to the competence requirement. But ISO 15189, it covers both quality and competence. That is the difference. So then as a medical laboratory, so you have to go for the ISO 15189 because it covers both quality and competence requirement. But the ISO 9001 that covers only the quality system requirement. So if you go through, I have given the source. If you go to this web link, then you can download this information. So then process and risk-based approach. Process, is a set of interrelated activities that will transform inputs to the output. So for any process, you will have some objective. From this process, this is my intended result, right? To get these intended results, then you will use different inputs, right? So and also you will generate some output. So when we in the general management, we talk about there are two words. One is effective, other one efficiency, right? Effectiveness and the efficiency, right? So that means effectiveness means, so if we can from our inputs, if we can get our reach our output, then we can say my system, my process is effective. So if we use input lesser amount of input, and we can reach our output. That means the what is the ratio input and output. So if we can get more 100% output from our use input, then we can say my system is 100% efficient, right? So then as a medical laboratory, so you have to break down your internal, if we say system, is a set of processes, right? So your medical laboratory quality management system, you can divide into different processes. So if you divide the processes, so then if you take one process, then you have to think about what is the input and also what are the output and what are the intended results intended outcome from this process, right? So as an assessor also, right? So now if I now as a laboratory, when you develop your quality management system, if you think about what is the my process, what are the relevant inputs, and what are the expected results, and what are the outcomes from this process. So then if you have good idea, good understanding, then easily you can, when you develop your system, you can write down your procedures, your policies, your worksheet, develop your worksheet, whatever the thing you can do correctly. And as an assessor, if I come to your laboratory, if I am going to now see how sample primary sample acceptance, or sometimes how you conduct the internal audit, how you conduct the management review, right? How you conduct the document control, like that different process I will consider, or how purchasing, right? So then I will think about, okay, so what is for this laboratory, what are the for this process, what are the inputs? Then I will ask some question. I will check some evidence whether you are correctly using, take some, consider your relevant inputs. And also I will check how they process those inputs and generate the output. Then I will, if I do the check the management system requirement, review process, so then I will ask, what are the input items you considered for the management review? So then definitely according to standard you can remember. So there's output. So then I will check, after doing the management review meeting, have you generated management review minutes, and have you identified what are the actions to be taken, and what are the decisions you have taken, what are the actions you have to be taken, and who is the responsible person, and like that, then whether you have defined, you identify your activities. So then from that I can check whether you are meeting the requirement of ISO 15189, right? So that is the way we should approach. So that is the process approach. So each and every activity, then we can think about what I am going to do, what are the inputs and what are the output, what is the intended result, outcome or expectation. So then you can have, if you have that in your mind, then you can carry out your activities very easily. So, and standard says, clause 51441C says, specify its procedures to extend necessary to ensure the consistent application of its laboratory activities and the validity of results. So because now you can see the standard nowadays, even 9001, so they are not recommending us to write the quality manual law procedures. So there are some places where they demand documented information or documented procedures, right? So other than that, they are not, because as a laboratory, so we have to think about what are the processes and what are the our inputs and what are the outputs. And from that, if you can generate, if you can maintain documented information, right? So from that, you can show how we comply with this requirement, right? So, and if we come to 8.11, the laboratory shall establish, document, implement, and maintain the management system to support and demonstrate the consistent fulfillment of the requirement of ISO 15189-2022. Right. So this also requires establishment of the processes, procedures, and the document. You can think about whether we need to document everything, or whatever. That is also risk based, right? Sometimes if you have now if you take a particular analyzer, so the now medical laboratory analyzers already guided by the manufacturer through the system. But even with that guidance, if you think, so we need to, if we do not have work instructions, the analyst, they will sometimes they will operate incorrectly. So there may be some damage to my analyzer, because these are millions of money, right? So then you have some risk. So analyst will not, you have a doubt whether my analyst will follow the correct procedures to operate this analyzer, right? So then if you have a doubt or the risk, because if they do not follow the correct thing, what is the risk? So there can be some damage to the instrument. So how we can avoid that one, right? So when you consider about the risk, sometimes you can say, sometimes we have to tolerate the risk and we can carry out. Sometimes we will introduce some procedures, right? Sometimes we will carry out the work under supervision, or sometimes some high risk activity we will stop, right? Or sometimes we will transfer our risk to the another organization. The best example, even now, if we have some risk when you do the medical, maybe surgeries and other things, there is a risk. So then what we have to do? So we will take a professional indemnity coverage. So if something happen, then from the insurance company, because sometimes we cannot pay, right? So because of that, we take the insurance to mitigate the risk. So that what we are doing here. So whatever our risk associated with our activities will be transferred to the insurance company, right? So we transfer our risk to some organization, or sometimes we stop, right? So that way we have to think about when we work in a laboratory. So now you can see, as a medical laboratory, I have taken all the requirement into one picture. So from here you can see from where we have to start. We have to start with the patients or lab users. They will come with the laboratory information. They will come to us to take the our testing services. So what is the end users? So sometimes the scenario will be different, because sometimes the doctor will patient will give the sample, but you will issue the report to the patient or the doctor, or according to the needs, or sometimes requirement. So sometimes we have to follow some ethical and some critical issue reporting, and also sometimes there may be some situation where there may be some cancer, or whatever the situation may be, what is the sexual related diseases, those things. So we will not directly inform to the patient. So then we will consult the patients or the relatives, and like that, then we have to follow the different way users. So anyway, from patients to the end user patients. So then within that, in between two activities, two stages, so then we have to do a lot of things, right? So then, as a medical laboratory, you have to declare what are the tests we are doing, what are the opening time, what are the fees. So that is a requirement, laboratory information for patients and users. So then when they come to the laboratory, so then we will have some agreement. So they will come with the prescription. So then we have to some service agreement, right? So and also we will have some they will come with the request pro getting the medical laboratory services. So then we have to consider about whether we can deliver, whether we have a capability. So like, and also then how we can collect the sample, and how we can, because now if we sample collection, so we can consider about our country situation. Sometimes there may be some big medical laboratory players. They have some central laboratories, and they may operate maybe thousands of sample collection centers, franchises. So they will collect the sample from the patient from the rural area, and they will transport those samples to the main laboratory. So there are many, it is like a network of activities. So then everything we have to consider under primary sample collection. So and then the testing, when we do the testing, whether we are using the validated or verified methods. So measurement uncertainty, and also analyzers, biological reference intervals, right? And also decision limits, and the documentation of examination methods. So in the standard required, we have to document the examination methods, and also how we can carry out the EQA, IQC activities, right? So then after generation record, then post exam, how we interpret the results, delivery of the reports, and those things we have to consider. When you do these process activities, so we need our laboratory staff, environmental conditions, we need equipment, and also when we consider about the equipment, that's very important thing, metrological traceability of, because when we take the measurements in our laboratory, that must be linked to the SI unit through unbroken chain of comparison. So if you go to the this ISO 15189 standard, so it gives what is the metrological traceability requirement. And if you have what is the copy of the ISO 17025 standard, so it has a different annexure also. to give the metrological traceability. So then you can consider them, and also then regions and consumables, how we can manage the regions and the consumables. Then what are the services, equipment, items we are purchasing from outside external provided product and services. Sometimes we have to use some referral laboratories also, right? So because sometimes in the event of breakdown of our instrument, so then we will send our sample to the external laboratories, right? So then control of data information, LIMS, Laboratory Information Management System, control of records, control of management system documents, all this will support many of the management system requirement will be support to this process. And other side, you can see management system requirement, corrective action, non-conformities, evaluation, internal audit, quality indicators, right? So like that. So there are different requirements related to this process. So to do all these things, so we have to be a legal entity, and we have to have a management, laboratory directors. So like that, then you can see this gives all the requirement in one picture. And when we carry out these things, we have to be impartial, independent. So every phase we have to consider that one. And also main thing, we have to maintain the confidentiality, we have to protect the information of patients, and also we have to ensure safety of the people, patients, and also privacy is also very important. So as we are sharing the experience, I can see now you are also mainly Muslim country. So and when I go to the most of the time I'm going to the GCC countries. So when we go to the laboratories now in our country, some countries they don't have a different queues for the males and females, but to maintain the privacy, so they have a different area, totally different, separated the sample collection and everything for the males and females, right? So like that, then we have to when we collect the sample and when you treat with the different peoples in the different cultures, different country, different environment, then we have to consider. Even ISO standard doesn't say those things about how we can deal, but as a laboratory, depending on the culture, country need, so then we have to interpret and we have to take some additional actions to maintain the requirement. So then when we come to the risk, so in the standard it says we have to consider all three processes: pre-examination and also examination and the post-examination processes. Uh, so when we sometime because this standard doesn't say we have to follow the ISO 31000, but I will give the some reference. There are some standard, so we have to follow. We have to consider when we analyze the risk. So we have to consider that guideline. So now, if you go to process requirements, some examples for pre-examination, right? Then you can say incorrect sample labeling, right? So failure to identify the samples, incorrect sample identification. Now you can see as medical laboratory community, you can think now you can see how in our my laboratory how we are doing incorrect sample identification, right? So how we can prevent to avoid that type of situation. Inappropriate sample for completion of test. Sometimes we will collect the sample because when the maybe sample collection center people, because it's a rural area, so sometimes that they employ some new employees, they are coming and going because sometimes they are no, their salaries are very low, so they will not retain. So then every day the sample collection centers they have a new staff, right? So then they will not collect when they take a sample. There's some minimum volume, right? So sometimes they will not collect it, right? So then to avoid that type of situation, how as a main laboratory, how we can deal with them, right? And also, even though this type of situation can be occurred, but there are some requirement in the standard by acknowledging. So some deviation, we can proceed this testing and issue the report, but we have to make a comment. So what are the deviations at the point of sample receiving? So then contamination of samples, the incorrect sample transportation handling, like that. There are some example for possible risks. So if you go to the now the how they these are some pictures how they transport from one place to another place, right? So then uh, if you consider the process, uh, examination process, so then inadequate waste disposal procedures, absence of EQA, IQA, then the incorrect dilution, errors in the data transfers calculation. This is the one of most of the common points we can see. Equipment failures, malfunctioning, right? So sometime now equipment failure. So what is the current situation in the laboratory, your laboratory? I think if I ask question from you, then you can say, if I will ask a question, if this analyzer has some issue, how do you manage your sample? Because you are receiving the 3,000 sample per day. Then you will tell me, so sir, don't worry, we have a backup machine, right? So because then sometimes you have not considered that is what is the issue, what is the risk, the failure or malfunctioning of instrument during the test or during the day. So there's a risk. If we have only one instrument, so if there's a breakdown, then we are in a high risk situation. So to avoid that situation, how what you have taken the action? So you will purchase another one as a backup. So then if you have a backup, then you can avoid the risk related to the malfunctioning of the equipment, right? So like that, then sometimes that one you have not taken into your risk analysis, right? You can think sometimes if you are working in laboratory, think about your risk assessment. When you do the risk analysis, did you consider this one? That is because sometimes we have taken actions, already we have taken some actions, but we don't know we have taken those actions due to risk, right? So if you think brainstorming by yourself, then you can think, this is a risk associated with this area, right? Like that, use of expired regions and also deviation from the methods, incorrect test selection or like that, then there may be different risks. And post examination, the incorrect results entries and also data incorrect results in limbs, issuing results to the unauthorized persons. So that is also very important. Maintain the confidentiality. Send the results on wrong patient, result to wrong patients. There are no limits. Then the lack of information and the incorrect results, report delays, like that, then there will be some associated risk. So levels of contribution from different stages for errors. Now you can see as you are a research community, scientific community, I have given some information, the already published information, publication. So this is also information from the one of the publication. So level of contribution from the different stages for errors. So normally you can see what are the main, if you consider the errors of the medical laboratories, in which ways, in which process, uh, uh, what are the how many errors or what is the percentage of errors, right? In which phase it can be happen. So what is the highest rate of errors or some issues can be detected, right? So then if you consider this paper, if you go through this paper, you can see 70.7 77.1% error occurred in the pre-analytical phase, right? And also analytical phase and post-analytical, and there are 1.5 undetermined. So then this is you can, if you go through this publication, you can get more information. So from here, I am also requesting for you, as you are a scientific community. So when you start your research, then sometimes you may do research every year. So, but think about the medical laboratory sector also. Then in your country, relevant to your, you can think about the context, right? Context of your research, and you can consider, you can take some issues, you can take some sometimes experience you gain, and that can be if you identify the gaps, research gap. So then sometimes there may be many research gaps related to the medical laboratory. So then if you go through this publication, you can see, so they have focused very narrow subject area, but it's very good. But in your research also, if you think about different stages, and if you start to do research, so that will give some value addition for you as well as your country development. So, and when it comes to the POCT, also you can see now this is the new trend. I taken it for one of our professors' presentation. So you can see the nowadays when you go to the doctor, right? So they sometimes they take the sample, and at the point of the what is the when you visit in the doctor, they will take the sample and see the results and give the decide the medication, right? So the because of this POCT instrument now is instruments are coming, kits are coming, right? Because of that now the trend is the most of the tests are going with the POCT activities, right? So you can see how it will reduce the time to not like other routine testing, but it will accelerate the results, and doctors can decide. But there may be some negative and pros and cons, but this is the now current trend. Now, according to 15189, so medical laboratories now they are including point of care testing activities, sometimes mainly some hospital laboratories, right? So they have some wards and some other external outpatient areas. So then they include POCT activities and sample collection centers, right? So like that, we have to consider. So if we follow now, if you as a now accredited laboratory, so then you can think about whether we need to include POCT activities, right? So sometimes it may be a added advantage, business advantage for you if you include POCT activities, right? So then I will come to now. I just gave some overview about the 15189. So and also then and there I told you how as an assessor how what is my approach in this area. And if you come to the accreditation assessment, so here normally if you go to 9001, they will come 9001 auditors will come to your laboratory and they will check your compliance, right? So whether if there's a standard requires to have internal audit, then if you have done the internal audit, that complies. So if standard required to have some register of approved supplier. So then if you have a register of approved supplier, then that complies. But as accreditation body, when we come to the laboratory, so then we will go for the both quality and competence, right? So as an accreditation body, accreditation assessment, how we can determine your competence, right? Sometimes without coming to the laboratory also, we can determine your competence. How? Right? So when we determine the competence of the laboratories, so we can consider even testing laboratory, we can consider on-site visit. We will come to the on-site and see your performance, your activities, and decide whether you are in the required competence level. Or before coming also, we can judge, make some judgment. How? If we go through your EQA, right? EQA received from the accredited proficiency testing provider. So if you have demonstrated your competency, your performance, ISW score within plus or minus 2 range, so that gives some indication about your competency, performance level. From that also we can get some idea. So you are a good laboratory, you are a good performer because you have received the good EQA results, right? But when you do the accreditation, that's also one of the input. And also when we come to the assessment, accreditation assessment, so we will consider whether how you comply with the requirement as well as we will assess your competence. How we can assess the competence during the assessment. So we will interview you, right? We will observe and mainly we will witness. So during the assessment, the accreditation body assessor will request the laboratory analyst to perform the different activity. Now, if we go to the sample collection centers, right? Now, as a part of your laboratory, then you have a sample collection center. So, as a main laboratory, how you control the medical, because it's a requirement in the standard, the laboratory shall ensure the quality of the primary sample, right? Then you have to ensure the suitability of sample you are going to test. So if you are getting the sample from the outside, sample collection centers, how you should ensure? How we can ensure? Sometimes you can first you will have a registration process. Before you register the sample collection center, then you will go there and visit, and you will check whether they have enough facilities, required equipment, required people, trained people, waste disposal activities, sample collection areas, and washrooms, and how they manage the sample, how whether they have storing facilities, how they transport. Sorry. Hello. Right. So sorry, like that, then you can consider. I think, Farisa, what is the how many minutes remaining?
We have like, because you have about another 11 slides. Can we have
Yeah.
within another 10 minutes?
Okay. 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 Let,
Right. All right.
okay.
Thank you.
Thank you. Because I can't see the time now. Okay. Now I. Okay. Thank you. So then when you register and you have a registration program, and then time your internal audit also will cover some sample collection centers, and you will give the instructions like that, then you can monitor, right? So those things we will, and also if you take the analyst, so we will ask them to perform the test, and as a assessor we will observe whether they follow the correct procedure. We go to sample collection area, we will check how the sample collection people, phlebotomists, collect the sample, everything we will check and determine whether the competent. And at the same time, we will conduct assessment according to the, we will check International Laboratory Accreditation Corporation policies, use of logo, and the proficiency testing, and the metrological traceability, like that different requirements. And also regulations and laboratory internal policies and procedures, use different assessment techniques, as I told you, and two phases in assessment, desktop assessment and on-site assessment. So we'll do a document review before we come to the assessment, and use EQA results, I already told you, and conduct and train and qualified competent assessors. To do these things, accreditation bodies also make sure that they are using competent assessors. So because APAC or the regional body will come to accreditation body and check whether the accreditation body also competent to carry out the accreditation activities. So through that, we will we as a accreditation body, we have to comply the APAC and ILAC requirement, and we have to go through the peer review process. So and the peer reviewers from the different accreditation bodies, they will come to the one accreditation body, and they will conduct the office evaluation of the accreditation body. And also same time, when the accreditation body is staff going to the outside assessment, the peer evaluators also will come with them and check how this particular accreditation body assessors conducting the assessment on site. So as an accreditation body, we have to comply with the another ISO standard, that is ISO 17.11, and also ILAC and APAC requirements. So and also ILAC MRA, they will grant it based on the regional evaluation done by the regional accreditation organization. Is in our case APAC, Asia Pacific Accreditation Corporation. You can see how this process is working. Then you can there are some patient sample that will be tested by the laboratory. So after testing the laboratory, medical laboratory, they will issue the test reports. So the medical laboratory should comply with the ISO 15189 and the ILAC APAC accreditation body requirement. So then accreditation body will come to the medical laboratory, and when the accreditation body comes, they have to follow ISO 17.11, ILAC and APAC MRA requirement. They will conduct the assessment for compliance and competence, and then they will issue the accreditation certificate. So then the accreditation body has to go through the APAC evaluation. So then for that, the APAC will use ILAC MRA requirement and the APAC MRA requirement. they will conduct the peer evaluation of to determine the equalization or equivalence, right? So then they will issue the ILAC MRA status. So, and the ILAC also will do the evaluation of regional body, right? So then that is the regional evaluation. So that is also based on the ILAC MRA. So after that, so they will maintain the ILAC MRA status for the region. So now you can see, as a medical laboratory, if you have obtained the accreditation from Standard Malaysia as an ILAC MRA partner, then your medical reports are accepted or recognized internationally all over the world, right, through this process, right? So then you can see ISO 15189 APAC ILAC recognition is a global competence in results, right? Laboratory accredited locally, another country questions results acceptance. So because the AB is an ILAC MRA signatory, the results are internationally accepted. So in your case, the Standard Malaysia is a ILAC MRA partner. So if you get the accreditation from them, so that will be accepted in all over the world. So there are some examples. We are looking for, I'm not looking for document, I am looking for the outcome. So like you can see compliance and excellence, right? We can stay in the safe, what is the competence zone, comfort zone with the compliance. But if you are going for the excellence, so then you can do some additional thing to make it as a good system. So you can see SOP exists for critical value reporting. Staff sign the SOPs. No evidence of timely reporting, no monitoring. So if we go for the excellence, SOP implemented, turnaround time for the critical values monitored, delays analyzed, improvement actions documented. You can see how we can do a better than the general compliance to the other when we come to the excellence laboratory. So if you go to next example, management leaderships. Management review, they will agenda is followed, same actions point repeated every year, no effectiveness evaluation. But this, if you are assessor, when you go to laboratory 2 or 3 times for the same laboratory, if you go, then you can see the same situation, right? But when you go to the laboratory, if they have some do same thing, but they are doing in a different way, and they are doing more things, right? So you can see excellent review includes EQA trained. Now the when we go to the next first time, you can see the management review just agenda followed, then they have a minutes. But when you go to the next time, then if they have done they have taken the EQA results, sometimes they are all the results are okay, but comply with the disco plus or minus 2, but still they are doing more. So they are taking the all the results and they are checking whether is there any trends in results. In the complaints, risk register updates, decisions lead to measurable improvements, like that we can consider. Then other example, risk assessment done only before the accreditation, stored in a file, right? You can see this situation. But if you go to the laboratory, the laboratory as a laboratory, if they can do risk identified for the sample transport delays and the equipment downtime, they are expanding their risk assessment one by one or day by day. So that is a very good sign of going excellence. So then technical competence, training record present, competence evaluations are completed. But when you go to the competency assessment through direct observation, they are using direct many techniques to determine the competency. And also sometimes the laboratory, they do competency assessment one time, but they are not monitoring continuously and they are not updating their competency knowledge. So those things we have to consider. And the MU, if you go to the MU, so MU calculated once, staff cannot explain its use. Sometimes this is a very good example. The laboratory, when they get the accreditation, they will go to the consultant and consultant will do the everything, even the uncertainty calculation. But when we ask from the laboratory, they are not able to do the explanation, even that what is the identification of type A and type B, right? So then if the laboratory, if you have some good system, then you can provide the training, you as a self learning, and also you can go for the training and understand different requirements and practice them and become as a good laboratory. So then examination, rejected sample recorded, record rejection. So normally we are doing it, but rejection reasons categorized as we discussed earlier, monthly trend reviewed, and staff retraining initiated. So like that, then you use different technique and you identify some areas for improvement to make it as your laboratory in excellent laboratory. So this is a post examination. So then you can see as a APAC, same non-conformity graded, different by assessors, sometimes even the accreditation assessment. So we can see the same laboratory, the same non-conformity, same issue is graded by the different way by different assessors. Right. So then that is why accreditation bodies, they are conducting harmonization workshop among assessors. They do the training, right? So like that, different activities they will follow. So then you can see some example how weak laboratory practices can affect the international competence. So as example, laboratory weak in corrective action effectiveness. So AB does not challenge the close of such non-conformity. If it is under peer review or peer assessment, then the APAC assessor will raise a concern on the AB competence, because the AB assessor does not more question about the corrective action process of the laboratory. So then the culture, so then culture change, the compliance mindset, we have some mindset, so we just comply. But we have to go for the excellence mindset. Let us identify risk before they become a non-conformity. Right, one of the examples. So these are the list of related standards according to the 15189. So and also I have given a list of publications. So you can get this. I think there are more publications, but I have given some important publications. You can. I will share this presentation. You can go through, and my request as a researchers, so then try to do at least identify, do some one research related to the medical laboratory accreditation or medical laboratory field. So then you can generate many cases and knowledge, share knowledge about this medical laboratory area. So then there are a list of case studies. So I will share this presentation, then you can get whatever the information. So I think I try to, because with the limit, I can talk more in different areas, but I am going to stop from here. So I think now I hand over session to Farisha. So then you can continue. Thank you very much.
Thank you very much, Bandu, for the excellent sharing. And I could see that you have really covered it from the definition, the general principle or perspective, and then you have a lot of examples given, and finally, what is the recognition and also the international platform that we have under accreditation. So thank you very much. Since today is a Friday, there is a Friday prayer, so we don't actually have much time. But if there's a question from the participants, I could not see any in the chat at the moment. Yeah, can we have one or two questions for Mr. Bandu, if anybody would like to raise that? Anybody? No? Okay, so maybe I just raise one, a simple question. So since Mr. Bandu has actually involved in Sri Lanka, and then you have exposed yourself to the international evaluation and also developing laboratories in other countries. So just a simple word that you could maybe summarize what is 15189 stage in the world where you are looking at in terms of being recognized, being used, being implemented. Thank you.
Okay, thank you, Marisa. So now I can see with the different countries. Even earlier also I visited as my part of the PA evaluation different countries. Even with you also, I went to one assessment. You remember, we have a good experience.
Yes, of course.
So uh, like a developing countries, Sri Lanka and Nepal, the Bangladesh, like that. Then when they implement ISO 15189, they face some difficulties in getting EQA and the reference materials, and most of the time those are the issues mainly faced by them. And
Okay.
when we go to the developed area, so they have a regular PT, IQC, everything, reference material, so they don't have issues. Then when we go as an assessor, if I go for the local, like a developing country and the developed countries, so then there's some big difference, because the developing country, they will participate at least to fulfill the requirement, accreditation requirement, they will go for the EQA and PT, they use the reference. But when you go to the developed area, they will day to day activities, they will use all the reference material, they will continuously participate in the EQA program. So that is the one of the things. And also when we go to the developing and other normal our context, so we have only 15189 accreditation. But when you go to the developing country, they are following other because sometimes, most of the time, laboratories are associated with the hospital. So for the hospital accreditation, they have different accreditation from JCI and other then. So sometimes they maintain many accreditations, even covering the laboratories and also hospitals. They have a joint accreditation activities, and our countries, they are following the 15189. Only one or two organizations they can afford to go for the international other accreditation program. So, and some countries, even US, so there are some strict regulatory authorities like clinical,
Yeah.
what is CAPM and other things. So then they highly regulated. So that is also they are running. So like that, then in the medical area. So if you go to the from the small, like if you take the Sri Lanka to outside the country. So when we coming from the Sri Lanka to outside, there are many compliance activities and the competence programs implemented by the medical laboratories, because they can afford and they have many availability. But other countries in our region, South Asian regions, so they have some limited thing. But if we come to the 15189, they are equal, because everyone should follow the 15189 requirement. It doesn't matter wherever, what is the country, they follow it. But additionally, they follow other accreditation programs. And also no, sometimes some countries, there's no regulatory or government, maybe yes, regulatory support for the medical programs. So that is also one of the things.
Okay. Thank you, Mr. Bandu, for the insight of international overview of how 15189 is being implemented and some of the challenges that has been faced by them. I think most of what you have mentioned is also happening in Malaysia. We started in 2004, and now to 2025, there are a vast improvement, yeah, to the medical testing services. Yeah, a lot of things has been changed. It has been improved, and now we have about 114 laboratories that's been accredited. So a lot of improvement, and also the importance of 15189 has actually been known to Malaysian medical services. So I don't see any question, and we only have 2 minutes left to 12:30. Secretariat, anything to be announced besides participants has to fill up the feedback form attendance list, and then only you'll be able to get the e-cert. Yeah. So e-cert also will be given to speaker. So they will try to email that to you maybe, or you shall fill in and that it will be auto-generated. I can see one question from Thailand. Oh no, it was just a thank you. So thank you. Those are all my friends, yeah, in Thailand, I think Brunei, and also Indonesia that has actually joined us. So thank you very much. So I think with that, there's no more question. And shall we give a big hand to our speaker, Mr. Bandu?
Thank you very much. My pleasure.
Yeah.
And if you have
any
if you have any information or any support, then please inform me, send me email, then I will share whatever the information.
Thank you very much, Bandu, for giving us the opportunity with you, and also the slides and the recording. And I think the Secretariat will have that the recording in the website. Can you just confirm that again, Secretariat? So usually it will be PPSM website, yeah, and also the slide also, I guess. Okay, so
I will email updated slide.
Yeah, the one that you gave me was not
Yeah.
complete as what you shown today. So thank you very much again, Mr. Bandu, to be with us, yeah, for almost 1.5 hours or 2 hours, starting 10:30, and also our 172 participants that have actually joined us from the early stage, and now we only have, most of them has left. Maybe they are rushing for the prayers. So thank you again, and of course, thank you to the Secretariat, Encik Zakwan, Puan Vidu, yeah, the PPSM Exco, and all participants that have taken this opportunity to be with PPSM ISW, yeah, 2025. So this will be the last, and there's a call for speakers. So Mr. Bandu, if you're still interested, you can fill up this form and we can have another session next year.
Okay.
So with that, yeah, with that, thank you very much again. And thank you to all participants and also Secretariat. So I've called this to an end. Thank you.
Okay, thank you.
Secretariat, you want to take photo? Whoever that's left or that's not a requirement, so that we can on our camera. Secretariat, well done, thank you, Cik Mi. Yes. Secretariat, do we need to take photo? Yeah, why not? Okay. So Cik Zakwan, can we take photo together with whoever that's left? All right, so let's on our camera, and I will try to put this with more. Okay, are you ready? All right, whoever that's in, yeah, switch on your camera. Hi, Madam Lau, Dr. Raja, Mr. Sun. Hi. Nampak gambarnya? Okay. All right, ready? Okay, Cik Zakun ambil gambar ya? All right, okay. Okay, 1, 2, 3. Hai, Dr. Rafiza lagi. Dah cukup ke? Cik Zakwan? All right, he has taken us with this memory of the last ISW 2025. Thank you.
Yeah, thank
Bye,
you.
see
Thank
you.
you.
Oh, pun
Bye.
Halimah tu nak dekat atas tu. Dah. Thank you, thank you. Alright. Okay, so kita punya speaker dah meninggalkan kita. So, Cik Zakwan pun dah nak berlari pergi solat. So, terima kasih semua lagi sekali. Yeah, so jumpa di tahun depan. So, Merry Christmas kepada semua and Happy New Year. Hopefully we can recharge ourselves for 2026. Yeah. Alright. Dah. Oh, Puan Dr. Yuni pun ada. Okay, bye. Thank you. Baik, undur diri ya. Okay.